what basically we understand in YouTube Live is we try to solve the questions and I try to help you in your practice. If you have any case first, please tell me so that I will start basically answering your queries rather than every time getting some mathematical symptoms and all. So I hope everybody has joined in. We can start the mathematical the YouTube session. If there are no questions, let me tell you the most common symptom which you get in your practice is that itching. And most of the cases of itching, when you repetize that case of itching, the simple remedy that every time comes is basically sulfur. It is very important to understand how do we take a case of itching. Yeah, I'm fine, thank you. How do we take a case of itching? That is very, very important. For example, if you ask a patient, he will say that I have a lot of itching, lot of scratching, burning, and then bleeding. Now, this basically is a very, very common symptom the patient will come and tell you. And most of the time, the remedy becomes either bryonia or, sulfur, bryonia, rustox, or arsenic and graphitis. First of all, you have to ask what is the most important presenting symptom the patient has presented to you. He comes with a lot of burning and then itching. Good afternoon, Dr. Devangi. He comes with a lot of burning and itching. Or there is first itching and then after itching there is burning. And after burning there is more scratching. And then when the patient scratches there is bleeding. Or the patient has just come to, he comes and tells you, sir, whenever I itch there is bleeding. So this is a very, very important symptom to understand. And then you can always ask, that itching is since when. Now itching can be maybe with diabetes. Itching could be when he started drinking alcohol. Itching could be because of fever. Itching would be sometimes on the hairy parts, the hairy parts of the body, either scalp or the legs or the hands and all. Or itching maybe because of jaundice. That is also possible. So then you can go forward and basically ask the question about itching. But most of the time the patient comes and tells you itching, and the first remedy that comes to everybody's mind is basically sulfur. Now how will you differentiate? This is very, very important. Now whenever the patient comes with itching, now in summer zone, because of the heat also, the patient comes to with a lot of itching. Of course natromur is the remedy, but then try to differentiate how is the itching. Most of the time what I've seen is itching with burning itching. There is a lot of burning and the patient start itching. Then you have to, of course, sulfur, arsenic, rustox are the remedies, but then you have to go forward and then you can ask the patient how is the itching and how is the burning. The patient says the burning is in patch and I have itching on that patch. So patchy itching and patchy burning, the remedy becomes limestone. Now if the patient comes and tells you there is itching, scratching after, bleeding followed by. So when the patient itches, there is scratching and the bleeding starts. Now when this symptom comes of bleeding, then apart from sulfur, there are few remedies you must think about. Of course, sulfur is there. You must always understand how is the bleeding. It is very easy. It is very sticky. The bleed is very sticky. There is something oozing apart from bleeding. That is important. So you can think about sulfur is the remedy. You can think about Merxol, lachesis, lycopodium, calcarea, dulcamar. Sometimes the patient comes and tells you that because of the itching, because of the patch, because of chronicity of complaints, that patch has become, there is a lot of offensiveness. And when this word offensiveness comes, you must think about psorrhina. Now, I had a case, where the patient had a lot of itching. I had given remedies also, but there was no result. Again, when I took the case, the patient started talking. So, of course, I took that symptom of loquacity also and added the remedy, lachesis, but it did not work. Most of the time, what happens that we basically, when the patient is loquacious, the first remedy that comes to everybody's mind is lachesis. Now, but still that loquacity of the patient was so marked with itching. So apart from the itching, I tried to enter the case through the mind symptoms. Now, apart from loquacity which is there in lachesis, this patient was talking without any pause. There is one more rare remedy which I have seen in my practice. In that remedy, it is written as garrulous loquacity. Garrulous loquacity. Now you have to first of all understand what is the meaning of garrulous loquacity, and you will get the remedy then. But you must understand what is the meaning of garrulous apart from talking. So garrulous means excessive, especially on trivial matters. मतलब एक छोटी सी बात है, it is a very small thing, and the patient starts talking from that, and he keeps on talking. Now, yeah, wherever this garrulous is there, you must think about Paris quadrifolia. Now, Paris quadrifolia is a very important remedy for garrulous loquacity. Garrulous means the patient will talk too much on very trivial matter. Then I went to the repertory and saw the rubric itching, bleeding, scratching after. And surprisingly, Paris quadrifolia was there in that rubric. Paris quadrifolia was there and lachesis was also there. But because I did not first think about Paris quadrifolia, because whenever we think about loquacity, lachesis comes first. But remember, in Paris quadrifolia, garrulous loquacity. Garrulous means the patient talks on trivial matters. Are you with me, everyone? So, garrulous loquacity, Paris quadrifolia. Are you with me? Welcome, Dr. Disha. Nitesh. Good afternoon. Which medicine have peculiar symptoms of nodes on wrist? Frankly speaking, nodes on wrist, I think you must be talking about ganglion rather than nodes. Is it, my dear friend? In wrist, normally it is not a node, it's called as a ganglion. So if there is a ganglion, then the remedies will differ. Yeah, ganglion. Now this is again a very common, I would say disease, because a lot of patients come to us and with ganglion, and I have found very good results with ruta graveolens. With ruta graveolens, it is almost as a specific for ganglion. Of course, the whole case taking is very important, but if you find it difficult to find the remedy, you must think about ruta, you must think about calcarea floor, you must think about natramure, you must think about phytoleca. But ruta has given me very good results. Of late, I am using ruta in LM potency. I start with thrice a day, then 0/2 twice a day, then 0/3 once a day, and then depending on the results, I start tapering of the dose of LM potency also. So please go home and read LM potency. It is very important, and you must know why to prescribe and how did LM potency come into Hahnemann's mind. And it's a beautiful, write-up of LM potency in Sarkar's Organ of Medicine. I have read from there. That's why I'm quoting it. You'll understand a lot about LM potency. Wherever you get chance, just hear, listen to webinar LM potency. It is very interesting. So we are talking about itching, simple itching, burning. We're talking about simple itching, bleeding, scratching after, and then you can think about something else. For example, if the patient comes and tells you, sir, it is not because of the heat I am itching, because I have to work too much, especially in the heat, I have itching. So either itching is because the body is producing heat because of exertion or because of the sun's heat. In both the cases, the remedy is natramure. Beautiful remedy. I have got fantastic results with this symptom. Suppose if the patient comes and tells you, I have lot of itching, and if I do some physical work, if I exercise, I do exertion, the itching goes off. Exactly opposite to natramure. See, if the patient exactly tells the opposite, then you are confused what to give now. So you must know both the condition, when to give Nactromure and when to give, when the physical exertion ameliorates the itching, the remedy is Agaricus muscarius. Yesterday only I discussed Agaricus with my fellow doctors who are working with me, and this is very very important. Agaricus muscarius. Do read Agaricus muscarius, the stages of poisoning from Boric Mater Medica, or you can also think about reading Agaricus from Clark or Boger's Synoptic Key, which basically I use in my practice. Now itching in jaundice. If you have seen my case where I had a case of itching in jaundice and a lot of sleeplessness, lot of indigestion. I prescribed the patient had so much itching. He had taken a lot of allopathy medicine, but no result. The only symptom I took for prescription was itching during jaundice, and I prescribed the remedy Myrica, Myrica, Myrica cerifia. So you can remember Myrica, and that treated and cured the case. Apart from Myrica, itching during jaundice, you must remember three remedies which I have seen in my practice. First is Myrica, second is thyroidinum, and third is I think Hiparsulf. I'll just check and I can tell you next time. So these three remedies are for itching. Now there are other cases where the patient says, I have itching only in the anus, in the urethra, in the ears. Lot of itching. Now you cannot blindly prescribe sulfur, but now the patient is telling you itching in the orifices of the body. Of course, sulfur is, my dear friend, everywhere it is there. You can always prescribe sulfur, it is not wrong, but there are remedies where the patient complains of itching in the orifices. Think about sulfur, think about petroleum, think about fluoric acid also. So these are a very very important symptoms in relation to itching. You can tell me your experience in treating this itching problem, because sometimes this treating itching problem becomes very very irritable and becomes very very problematic. It does not get better only. Now I had a case, itching in the groins. There are a lot of common cases, itching, so much itching. The patients applied a lot of antifungal and taken a lot of allopathy medicines, but till he takes the medicine, itching is better. You stop it, it's back to square. The itching is so severe in the groins, and you ask the patient, what do you do? I said, if I don't want to itch, what I do, I just tap it and rub it like this, and I feel the itching is better. So itching is better by rubbing. Itching is better by rubbing. Which remedy comes to everybody? This everybody knows. Which remedy comes to your mind? Anyone? Yeah, itching. The patient comes, and in the groins he comes and he's just rubbing around the groins. In your OPD also, he's not itching because he feels better when he rubs there. My dear friends, think about croton tig. Think about, no, not Drosera. It is croton tig, and one more remedy you can add, Diascorea. But Diascorea is more prescribed when there is itching without eruptions. Okay, so this is okay. One more thing, the patient comes to and tells, I itch so much. See, it has become like a wound. मतलब घाव हो गया. It has become like a wound. You understand? It becomes very red. It becomes very raw. And then the patient says, when we say don't itch and don't go in the dusty weather, because if the dust settles down, it is secondary infection, then there'll be a problem. So the itching is so severe that makes the part very raw. And these type of case patients will come to you maximum, because I have seen maximum cases comes to us because the patient has done itching so much, the area has become totally raw. Okay. Then now you must think about a very different type of prescribing. Of course, sulfur is definitely there, petroleum is definitely there, and graphite is definitely there. Sulfur will be with itching and bleeding, petroleum will be a lot of cracks, and graphite will be cracks with oozing of moisture, whatever is present in the mater medica. There are some remedies which are very very important, which are never thought of, but you must think about this remedy when the patient comes to you. Sorry, there was lot of loss of connection. So the patient comes to you with itching and the part has become raw. Now, whenever you can see the part raw, reddish, threatening, think about few remedies which are very, very important apart from what I have told you. There is one more remedy which I have used very sparingly, I can say, and the remedy is Tila. Tila. Please go home and read the mathematics of Tila. You will, feel it is such a infrequently used remedy, and you will find very, very good indication in Tila. One more remedy that you must think about is sepia. One more remedy you must think about is carbon sulf, and one more remedy you must think about is alumina. 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 Apart from this, there are other remedies also, but these remedies generally I have used in my practice with very, very good results. When the area becomes raw, just one word the patients tell you, sir, I itch so much, until it bleeds, I keep itching. Until it bleeds, I keep itching. If the patient is using this word, you must think about arsenic. You must think about, again, a very infrequently used medicine, chlorum hydrate. CHLORALUM, chloralum hydrate. Itching until the area becomes itching until the area starts bleeding. So arsenic, chlorum, boista, and you can think also about pulsatilla. So this is in general whatever query I had got in this 3-4 days on the WhatsApp. I have tried to sum up the queries and try to give you the answer about itching, what to think about itching and how to take the case. I hope till this everything is clear. Welcome, Doctor. Good afternoon, Dr. Bharat. I hope this is clear, whatever I have told you. Or you want something more about the remedy? I am not discussing Matermedica because that is there in the books. You can go and read. And one thing only, when the patient comes and tells you there is itching, and because of itching, it keeps changing places. Sometimes I have itching here, sometimes itching in the groin, sometimes itching in the back, sometimes itching in the elbows, and those are the symptoms. So itching when it keeps on changing places. Now I am telling you this because whenever there is itching, scratching, and changing places, one remedy that comes to everybody's mind. And what is that remedy? Anyone? Itching, changing places. Don't think only about pulsatilla. Okay. Now itching when it changes places, and the patient says there is itching so much. I feel what will I do? I'll scratch, it bleeds, I'll take out the skin, whatever the patient tells you. First remedy you must think about is cantharis. No, doctor, it is not stilla, it is Tilla. 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 Itching, changing places. Think about itching is so much, it is bleeding, raw, everything you can add, but it is changing places. Think about cantharis. Think about acid sulf. Think about Staphysagrina. Think about spongia, which normally we do not think in case of itching which changes places. We basically, everybody including me, would first think about pulsatilla. Are you with me? Hello, are you with me? Are you understanding that? You can keep talking to me so that I know that everybody is there, everybody is understanding what I want to tell you. Now the patient comes and tells you bladder obstruction medicine. Okay, so now see, you must understand why is the bladder obstruction. It is because of some structural problem, or it is because of the weakness, the tonicity of bladder is gone, or it is because that the opening has become small because of cystitis. Then you can think a lot of medicines. You can think about simple obstruction, especially thiocyanamine, cantharis, petroselenium, rustox, calcarea carb. You can also think about remedies like graphitis and sulfur also. Just a note which I want to tell you in this case. Whenever you have these type of obstructions, and you feel that the remedy is right but it is not working properly, in those cases sometimes I use vitamin C as an intercurrent remedy, or to give a boost to my indicated remedy if I feel that the remedy is right. Okay. So I hope till now it is clear. Now sometimes the patient has a very typical symptom in relation to itching. The patient says, "Sir, when I go to sleep, my mummy, my father, my wife, my child, or whatever, whoever is there, they tell me that I itch during sleep." Now, this is a very, very important symptom. Why? Because it is becoming involuntary, my dear friend. Itching during sleep. Itching during sleep. Okay, itching during sleep, my dear friends, fantastic remedy. You must remember this because you imagine somebody sleeping behind, some friends are sleeping and one friend is keep on itching here, and he does not get up. He is itching in sleep only. This becomes a very, very interesting symptom, my dear friend. And you write the remedy also. The first remedy you must think about when this itching during sleep is bratacarb. Bratacarb. Second remedy, Dalkamara. Third remedy, Causticum. And fourth remedy, if I am right, if I have not missed, is phosphorus, my dear friend. Now, I have told you itching during sleep. So you must also know the patient comes and tells you, "Sir, when I get up from the sleep, I am itching." Now, there is a very minute difference during sleep and when I get up from sleep. Okay, let me have this question answered. Chronic constipation with semi-solid stools consisting and never done feeling. Peculiar symptom, stool passes 20 minutes after consuming tea. Okay. Now, Nitish, just what you call, go forward. Just have one jump from your mind and think, why is the patient telling you? The patient can tell you, after taking tea only I get stools. After taking tobacco, I have stools. After drinking water, I have stools. I have to exercise and then do something and then I have stools. Means the bowel movements requires a push. Bowel movements requires a push, otherwise the bowel does not come out. Can anybody think of something more? Anybody can think of something more in relation to mind? Anyone? My doctors who are working with me, if they know the answer, don't answer, because this is a very, very interesting, Dr. Nishit. Of course, you can think about all the remedies, like bryonia and opium and selenium and thuja and sanicula. You can think a lot of remedies. But what is the body telling? Give me a push, then I'll come out. That can be pushed. So the body wants some, yes, lack of initiation. Very nice. I told you don't answer, but somebody a doctor who is working me has answered the question. Initiation, lack of. He has to be initiated and then he works. मतलब उसको हलाना पड़ता है, बोलते हैं ना. He has to be shaken up and then the stool comes. You can think in that lines also, Dr. Nishit. So initiation, lack of, think about Silicia, think about Calcarea floor, think about Lycopodium, think about Calcarea carb also, think about Aurum metallicum also. And these remedies are also for constipation, my dear friend. Both you have understood, okay? Both, I hope you understood. Calcarea carb is for constipation, Calcarea floor is for constipation, sulfur is for constipation, Silicia is for constipation, Lycopodium is for constipation, and these remedies also are initiation, lack of in the rubric of mind also. Okay, so I hope you understood, Dr. Nishit. I hope please do tell me so that I understand that you are understanding that part of also of the practice, how to get the physical symptom and in relation to mind. In 7-month baby, if itching like mouth and foot disease, whenever you have 7-month disease, first of all think about atopic dermatitis, my dear friend. If it is atopic dermatitis, then you have to take the whole case, because it is basically in relation to the pregnancy as the fetal history from the mother. That is important. So premature allergic medicine with urine problem, premature allergic with urine problem. Basically, if you are taking ejaculation as a symptom to prescribe, I have never used that, as a constitutional prescription for ejaculation. But there are few remedies which you can think about in your practice. You can write down ejaculation premature. There are a lot of remedies, but then I'll tell you something in relation to premature ejaculation. You can think about, of course, lycopodium is there, zincum metallicum, phosphoric acid, caladium, natrum carb, selenium, cobaltum. Whatever remedies I have told you are basically remedies for action for sexual spheres also. Okay. Are you with me, everyone? Are you understanding? Yes or no? Now you can't keep asking the patient. Of course, this is what I'm telling, that how quick it is, and during an embrace or during, there are a lot of other things with the least excitement or with short erection, and there are a lot of other sub rubrics and a lot of questions you can ask. So if you're prescribing on this symptom, very difficult to get the remedy, because I have not got the remedy in these cases. So I would suggest you ask some more symptom and then prescribe the remedy. Sinusitis, aggravation from house cleaning dust. Yeah, so this is again a very very common symptom, where you do dusting and there is a lot of sneezing. Now in this case, sneezing is because of a protective mechanism. The dust should not go in the system, so the body is trying to take it out from sneezing. So it's a protective mechanism. But still you want to know that catarrh problem, itching problem, coryza problem because of sneezing, think about histamine. Yes, you heard it right. Histamine is a remedy in which we give antihistaminics in allopathy. In homeopathy we have histamine. I also have the remedy now. Bromium, natrum ars. There's one more rare remedy which I have used lately in my practice, Elexon. And you can also think about, I think, benzoic acid. There are 3-4 remedies which I can get now from my practice, from my initial medical whatever knowledge I have the remedy. So yes, bromium, yes, it is there. Sinusitis. So these are the remedies you can think about, but it is a very casual prescription and a very common symptom. So you have to first ask the patient, why is the patient hypersensitive to, or why is the patient reacting so sensitively to this complaints, and you can take the case and go. How stool passes without tea also, but after consuming tea, stool definitely comes even done. Patient is thirsty, calm. Okay, patient is thirsty, slim, frequent urination. Now, if you basically want the remedies for these type of complaints, I can give you, there are so many remedies. I was just trying to tell you, you can also think in these terms also. So urination and the patient is thirsty, you can think about lycopodium, think about platina, think about Naxomica, think about plumbum, think about graphitis, think about calcarea car. You can think about causticum also. These are the remedies you can think about. With frequent urination, yeah, you can think about this remedy also. Of course, ask some more. There's one more remedy which I have used apart from zincum med, that is zincum phos. You can also use these remedies, and you will definitely get good results with that. But with this symptom, do add some symptom in relation to the patient as a person. That would give you better understanding of the remedy and better confidence of prescribing, and you will be very sure that you can hit the remedy on the first instance also. Now this constant desire to urination during stool, you can think about, there's a one rare remedy which I have to use, lilium tig and lachesis also. Okay, so let us go forward. Yeah, did you get the answer, Dr. Nishit? That is important. Yeah, so this is now you can also think about patients suffering from constipation from excessive drinking of tea. I had a case where it's a very rare remedy, kali hypophos I had given in this case, and that gave me good results. So this is, when you ask symptom, ask more precise defining symptom of the local symptom, then automatically you will get the remedies very easily, my dear friend. Okay. Hypersensitivity means how we ask. No, we ask, why is the patient reacting so much? No, when I go in the dusk, I don't have a problem, but that patient has a problem. So there is something in the body which is reacting more. So ask mind, I'm telling you mind, for which thing in life the patient is sensitive to. He reacts more than normal in the mind. That is the hypersensitivity, what we're talking about. Okay, so it's already half an hour up, and thank you for joining me, and thank you for asking nice questions. It is also my revision. So I hope you enjoyed as much as I enjoy sharing knowledge with you. Thank you. Until next Thursday for the Instagram live. Bye.